For our broadcast, the importance of COVID-19 testing. Thank you for joining us today. Listen, do me a favor, invite your friends, share this, begin a watch party as we talk about the importance of COVID-19. Listen, we are so glad to have joining us with us today, Ted Jankowski, who is the Director of Public Health and Safety and Welfare for the city of Stamford. Thank you so much, Ted, for joining us on today.
Thank you, Reverend. Thank you for having me, and good evening to everyone that's out there.
Also with us, we have Dr. Tabitha Fort. Thank you so much, Dr. Fort, for coming and joining with us on this broadcast.
Oh, thank you for having me too.
And Guy Fort is the president of the local NAACP, and he's with us here as well. Guy, thank you for joining us on today.
Reverend Dr. Ford, thank you for having myself, and looking forward to this discussion with a lot of the good folks.
Well, we're here today to really talk about the importance of COVID-19 testing and why we should get tested. I'm going to start with Ted. Ted, can you tell us what the city has been doing concerning COVID-19?
Sure, Reverend. I'm going to go back to January. And back in January, we started tracking what was happening in China in terms of COVID-19. We started meeting with the hospital. I would say we probably started really pushing forward in the middle of February with our preparations, starting to order supplies, surgical masks, other personal protective equipment. The hospital was an exceptional partner. We worked with some of the great infectious disease doctors within there, Dr. Perry, Dr. Shaw. So they were helping us in our preparedness, as well as themselves becoming actionalized to respond to it. I would say in the middle of March 12th, approximately, we had our first positive case. And at that point, we started really trying to respond to COVID-19. But prior to that, we were starting to prepare. When I say prepare, we were trying to get that PPE and extra PPE out there for our residents. Initially, though, the PPE was not available, so we had to focus on our medical professionals as well as our first responders to make sure that they can get out there and respond appropriately. Once it came to Stamford, it increased exponentially. I would say that we probably peaked when you look at the data at the end of March. But what we saw is a lot of individuals, especially seniors or individuals over the age of 55, they were the people who were out in the community. And those were the individuals that we saw being admitted into the hospital first, because, again, very proactive with the community, a lot of close encounters. And I think everybody on this line knows how this spreads. It spreads by close proximity. It spreads by the droplets. So when somebody is showing signs and symptoms, that's when they can spread the virus most. But individuals who do not have symptoms, they have a tendency, or they can also spread the virus. So the response we saw, our EMS, they were going on 14 calls a night for individuals who were sick. And as it turned out, most of those individuals that they were responding to were sick with COVID-19. We did start testing, and I can tell you that was Mayor Martin's biggest order, is get testing out there. We need to know how many people have it. They need to be taken care of. They need to be treated, and they need to be isolated, quarantined, seeking medical attention to make sure that they do not spread it to the rest of the population. So we did start on that testing campaign right away. We partnered with many associates out there. At the time, we had 4 testing sites. We had Murphy Medical Associates, who was running testing out of Cummings Park, Doc Surgeon Care, who was running testing on the west side. We had Stanford Hospital that was running citywide testing, but focusing actually at their campus on the west side too. And then the city, we had a testing site up at West Hill High School. With the testing, we were hoping to have more people tested, again, so that this way, one, they can be aware of their own health, get medical attention as needed. To date, I think we've had over 12,000 people tested. 33% of those people tested were positive for COVID-19. We did see trends, and we have a public safety data analyst. Different communities had higher rates of infection. We saw the Hispanic community; they had the highest rate of infection percentage-wise. And again, we're going based on population. We saw the Black community a high rate of infection too. So we started focusing on those communities. We did collaborate with the NAACP. Guy Ford and I, he spent countless hours trying to determine where we can intervene. They had an exceptional campaign. They raised a lot of money to provide masks in the east side and the west side where we saw the high levels of infection. And we focused on those buildings where we saw a lot of positives. So again, a successful campaign, because if you have a mask on, you can maybe prevent somebody else from getting it. It actually stops that spread of the droplets. And again, we ask people to maintain that social distancing. But our testing campaign, I can't emphasize enough how important it is within the communities. If you go based on population, I believe the positive case rate for the Black community is over 20%, and the death rate for the Black community. And again, this is based on our census and our population was over 20%. So 193 deaths, one too many deaths from my take on it. Again, we try to intervene as much as possible, but it's not over. And I do see a lot of complacency out there. I do think a lot of people are saying to themselves that this cannot happen to me. They believe that if they're not showing symptoms, that they may not have the virus, and that's not true. And that's why we are pushing testing. And Reverend Ford, I appreciate you running this campaign with Guy Ford and Dr. Ford. Getting out there and testing is really going to provide for that health and safety of all of our residents. And if you think about it, you may not be feeling well, but if you go for the test, you may be positive. And once we are able to know that somebody is a positive for COVID-19, we can take those protective measures to help them protect their loved ones and help them protect their neighbors, because they will be treated medically, and then they will also be quarantined or isolated to prevent that spread of COVID-19. Now, some people are going to say, well, you know what, I probably don't have it. I haven't been out and about. I have been quarantined. I can tell you with our testing with our first responders, initially we saw that those individuals who did not show any symptoms, considered asymptomatic, when they were tested, we saw an infection rate of 4%. And that's a high rate for people who were not understanding that they could potentially be infected with the virus. So we are pushing for testing, more testing. We have been putting out different mask campaigns and distributions. I think to date we've handed out over 150,000 masks, and that's some feat. Getting back to that complacency, we do see a decrease in the number of people calling our testing lines. When we were right in the middle of it, everybody wanted testing. And again, I guess there's that false sense now where everybody's saying, okay, I don't have to be tested. But again, testing is key. Wearing masks, social distancing, that's going to provide for your safety as well as the people who you love and everybody that you encounter.
All right. Let me ask, in Stanford, are the cases increasing or decreasing? How are we doing so far with the testing?
So I can tell you we are seeing a decrease. The main portion, I would say, where we found positives were from the end of March through April. The testing is continuing. We had testing going on recently. We are still seeing individuals being positive. But remember, without testing, you can't remove that individual from the general population, and they can infect more. And what we're concerned about is a resurgence. So even though we are seeing that curve go down, we need everybody to continue to be prepared, to continue practicing those safe practices of social distancing, wearing masks, and being tested. And I know you're going to introduce them soon. The NAACP, again, they are pushing the testing also, and Dr. Ford is also pushing it. So a lot of good stuff happening. We need you. We need other reverends, other ministers, priests, rabbis, to try to get to your congregations and really push the idea of testing, because testing is really going to make a difference.
Wow, thank you. Let me ask, there's a question that was given. It says, a family member of mine is in a nursing home facility. Why are the employees not tested as they work extremely close with patients?
So I'm going to tell you through my experience, that was one of our biggest concerns, the nursing homes, the skilled nursing facilities, as well as the senior residences. It was a concern of Mayor Martin's too. Now, the nursing homes, believe it or not, we do not have authority over the nursing homes, those senior facilities. But going back to March and April, we were in constant contact with them. We were making sure that they had the appropriate PPE, and then we were actually pushing for them to test their workers on a routine basis. And by our insistence, they collaborated with us. They did have their employees tested, whether it was through the city's program or through their own private programs. But they did test individuals as well as the residences. And some of the nursing homes were more proactive than others, but they were all doing their part to make sure that the testing was performed. Because again, if you have somebody who's dealing with patients all the time and they're positive, there's a good chance that they can be a vector of spread.
Thank you. Wonderful. Let me ask you one other question. Going forward, I know the city has tried to test as many individuals as possible, but what is the city's strategy moving forward in testing? What's the goal of testing right now?
So the goal is to get as many people tested as possible. And again, once we're able to identify somebody, we can actually make sure that they get the medical care that they need. But that's going to allow us to reduce the spread of the virus. Again, more testing, the better. Our testing strategy moving forward is to have everybody in the city tested. Again, it's very difficult to get that word out there. So that's why we're asking our religious and community partners and leaders to work with us and making sure that we get that message out there about how important it is to be tested.
Phenomenal. That's it. If there are any other questions for Ted Jankowski, we ask that you would put them in the comment section of Facebook and YouTube so that we can ask them. He will have to leave us shortly, but he definitely wants to answer any questions that you may have. And so we'll wait for a couple of minutes just to see if there's any more questions for Ted. But as we are waiting, I want to switch my attention to Mr. Guy Fort, the president of the NAACP. And Guy, if you could just tell us a little bit of the initiative that the NAACP has been doing and what the NAACP in partnership with a lot of the churches are trying to do now.
Yeah, so again, thank you very much, Dr. Ford. The black and brown battle in Connecticut is amazing. And we knew that this was happening back in, late April, early May, that things were going to be coming about. So what the NAACP did was we came together with the city of Stamford, because we're into a collaboration mode with different organizations. We came into this collaboration mode with the city of Stamford to give out, like Mr. Ted stated earlier, about 28,000 masks. We raised $23,000 in 9 days. And in those 9 days, we were able to purchase 28,000 masks. By purchasing those 28,000 masks, we then worked in collaboration with the city of Stanford, with the Vita Partnership, Pam Kaprowski, and different organizations, and Vince Tufo and so forth. And we came up with a strategy that instead of having the people come and get the mask, why not bring the mask to the people? So working with Ted and the city and the mayor, we connected with the CERT team. That's the Ted, if you can, I don't know, critical incident team, I think it is.
The emergency response team, right?
Yeah, the community response team. And we put together these masks, 10 masks per 26 apartment buildings in the city of Stanford, which was 28,000 masks in about 9 days. So we masked a lot of people from all of the, the different areas. So we went from the west side to the east side. And then we had the police department and the fire department deliver the masks through Ted and the organization. So the impact was amazing, is amazing. And we wanted to continue on building these types of foundations, because the NAACP itself cannot work on its own merit. We have to work with you, the community. We have to work with the pastors. We have to work with the different organizations in order to fulfill some of the needs and desires of what we're trying to do. So again, even working with you, Pastor Ford, we looked at trying to help put together this Concerned Clergy Coalition, which is an awesome coalition where all the majority of the pastors in the city of Stanford are coming together to try to make a difference for Black and brown people. And at the end of the day, we know that the health disparities are huge. We know that there is social injustice. I know a lot of people have been asking, why hasn't the NAACP been out there in the streets, marching and things of that nature? And it goes back down to our health is the most important thing. And, we have been informed, if you notice all around, we've been informed not to get out there and get sick. And I don't know if you know or not, but it is spiking again, because a lot of people are, like Ted said, a lot of people are getting extremely comfortable. A lot of people are letting down their guard, and it is vitally important in ways that we come together. And we came up with this idea of this targeted testing. We have to target the Black and brown people to know where this virus is, and then to agitate it and then mitigate it and get rid of it.
Awesome. Phenomenal. Let me ask, this question was asked: with our social distances and wearing of the mask, a person is not showing any signs, then they test positive and they stay home in quarantine. Is there any treatment? Ted, Dr. Ford, if you can answer that.
Dr. Ford, do you want me to take that, or?
Yes, sir. Yes, sir.
I'll take that.
Okay.
Okay.
So I'll take that. So the question is there any treatment for COVID-19 or, and the answer is there is no direct treatment for the coronavirus, novel coronavirus for 2019. And we labeled that the disease as a COVID-19 disease. There is no specific treatment. So what we're doing with that, when people are positive and have symptoms, we're really treating the symptoms or some of the effects, some of the medical effects from the coronavirus. So if it's fevers, body aches, chills, we're treating that. If it's nausea, vomiting, we're treating vomiting. If it's some of the more severe symptoms like respiratory distress or respiratory failure that requires oxygen or hospitalization, we're treating that. Some of the other complications are blood clots. People get inflammation in their bodies or in their blood vessels that causes blood clots. We're treating the blood clots. So there's right now, on an outpatient basis, there is no specific treatment. If people do require hospitalization, then we still don't have a specific treatment, but we're learning trial and error that some medications have been helpful. And so, and it's not really clear on which one tends to work better for which person. So it's difficult to say, use this medicine for this person and that one. But there are medications, antiviral medications that have been used, and even some of the anti-malaria medications that have been used in a hospital setting. That's not an outpatient setting. A doctor shouldn't be handing you those medicines and you going home because of the side effects can be more significant than the actual coronavirus.
Well, thank you. Ted, I know the city is reopening. There are restaurants and you're able to eat outside and everything. But is it truly safe? Can I go out and eat outside with my mask and social distancing and not worry about catching COVID-19?
So I can tell you, Reverend, we are following the CDC guidelines. And when I say that CDC guidelines for that social distancing, the wearing of masks, and reopening of the city, I could tell you, the mayor, we've been taking very cautious steps as we move to reopening. We're following the state of Connecticut guidelines for reopening. I could tell you when I've been out there, whether it's been with the marches that have been going on, people are wearing the mask. So I have to give everybody a lot of credit there. With the marches, we do have to try to maintain social distancing. It's a very difficult time right now to do that. But I am proud that everybody is out there and using their voices to be heard, but they are wearing the mask. So that's a positive. Now, reopening the city with the restaurants, we had a task force that was comprised of our director of health. The task force was our chief of staff, Michael Pollard, Thomas Madden, Economic Development Director, as well as DSSD and other representatives from the restaurant community. So we actually formulated a plan how to open it safely. And I could tell you, when I've been around and our health department inspectors are going out inspecting to make sure that they are in compliance with that social distancing and making sure that individuals are wearing masks when appropriate. So far, we are seeing compliance. As a matter of fact, this morning I had a meeting with the director of environmental inspections, and she said at this point everybody is in compliance. They have not had to issue any type of citation. So, is it safe? I think yes, it is safe, but I think everybody has to use some common sense and make sure that they follow and they protect themselves by wearing the masks, creating that social distancing. Because everybody does have a responsibility for themselves as well as for the people that they're with and their loved ones back at home too.
And let me ask a more personal question then. Are you eating at the restaurants outside at these restaurants right now?
Reverend Ford, if you can see me, you would say yes. He's been eating in the restaurant. Yes, I have been out there.
Well, awesome. Thank you. I know that you have to go. We would love if you can stay around, but if not, we definitely understand. And at any time, just let us know, and we can take you off. Well, thank you so much, Ted, for joining us on today. All right.
Thank you, Reverend.
All right. As we continue, I want to talk more with Dr. Fort and Guy Fort, who is the president of the NAACP, in terms of what we are actually trying to do. Guy, can you explain a little bit more what we're doing right now?
Absolutely. So, I mean, we all know and we all look at what's going on in terms of Black America, and you see that we have really, and everyone knows, we've really suffered the brunt of discrimination over the last hundreds of years, and that it also continues now, quite frankly. But I think our oppression has reached its boiling point, and if we don't do something about change, first and foremost, the bottom line is we have issues with ourselves. We have food issues. We have workout issues because we are, the majority of us, including myself, are essential workers. We're frontline people. We're out there in the streets. We are the bus drivers. We are the, getting out there and getting after it as much as possible to provide for our families. with that said, when this crisis hit, which was very amazing to each and every one of us, and I think a lot of people have forgotten that it happened. And unfortunately, you know, with Mr. Floyd's death, it almost dissipated. It's important for us to target what we're trying to do. So in our community, an example on there are buildings in the city of Stanford I know that are hot spots for coronavirus. And if we are an essential worker and we are traveling outside of that building and we're going to work, one of two things. Either we already are asymptomatic and we don't show any signs of anything and we go to work and we either spread it, or we have no symptoms at all, we are negative, and you go to work, someone contracts you, now you bring it home, and the problem is it begins to not dissipate, but actually multiply throughout the not only your home, but the building. So, you know, I spoke with Ted early on and said, hey, we need to specifically hit on certain areas. We need to hit certain buildings. We need to make sure that we can eradicate this problem within those locations. And, you know, at that time, it was really early on. Everyone was just, you know, we have a much better handle on exactly what's happening now. But then, you know, there was no process. So the process now that is that we can come back together within the community. And the ideal is to come back to the churches where the majority of the Black and brown people are, come back into the churches, come back into those locations and open up the doors and say, hey, we need to test our people so that A, we do not spread it amongst our people. B, we do not continue to spread it if we have it out into society, and to keep Black and brown people healthy. So that was the most important and significant manner of trying to put this ideal of the Concerned Clergy Coalition together, because the majority of our people are in the churches, and the NAACP is built on the back of the church. So we needed to step up with this agenda and this action point and make it work. And I think by you doing this and Pastor Perry and all of the different other locations, the churches coming together, this is just the beginning of what the NAACP has in front of it, dealing with the churches and the Concerned Clergy Coalition. We have a lot of great things that we want to work on regarding disparities, and that's financial disparities, that's COVID-19 disparities, health, so forth and so on. So we got a lot of work to do, but we need the Concerned Clergy Coalition's help, and also we need members to help out on the forefront, because we can't do it alone. There's only a few of us.
So, Guy, when you reached out and you talked about the importance of doing this, and we talked about the clergy, right away we reached out to Dr. Tommy Jackson of Rehoboth, Dr. Robert Perry of Union, Pastor John Luke Charles of the First Haitian Free Methodist Church, Bishop James Hinton, Pastor Gerald Hampton, Apostle Streeter, Pastor Johnny Bush, and Bishop David James, with a lot of the other pastors within the area, to try and put something together so that we can service our communities.
Yes.
I think it was a great idea, and it seems like it has come together. And so let's talk about now what we've actually put together and what we're trying to do as a whole.
Right. Well, as you know, working with yourself, I mean, you were extremely open arms in getting this, helping bring this into a reality. So it was a vision, and and I'll say this because Tommy Jackson gave me this a couple of days ago. He said in 1968, at that time, former President Nixon said, and he just won the vote barely by the electoral vote by 0.7%. And he said, we work better by working together. We work better by working together. I do not have the solutions for everything. Neither do any one of us. So if we work together, we work better by working together, by saving a life and changing a life. It's the importance of working together. So when I talk with you, Pastor Ford, and I want to thank you for being the lead liaison of all of the clergy here in the city of Stamford to get this thing going. Because sometimes, not from a negative perspective of people are on different agendas, but people have their own homes to take care of, and I get that. But we work better by working together. And you came on board and immediately reached out to several of the clergy around the city of Stamford, and I'm very grateful to you for doing that, because you stepped up, and the clergy are on point. And like I said, this is just the beginning. We're going to work on primary care of our health. We're going to work on our finances, and I just want everybody to be able to come together for these different church events and church opportunities that we're doing, and I think we can make a difference.
Let me say this. This was a real collaboration. In order for this to really come to pass, we had to have everyone buy in. The city of Stamford, Vita's partnership, Dr. Tabitha Fort, the NAACP, Optimus, and CHC. In addition to the NAACP and the Concerned Clergy Coalition. All of us are working together in order to try and get this testing done. And so what we came up with was Operation Combat COVID, Healing, Health, and Wellness. And what it is, so far we have 3 sites where we will be offering tests. The first test will be done June 18th from 7:30 a.m. to 11 a.m. at Faith Tabernacle Baptist Church. And then we'll have testing on June 20th from 8:30 a.m. to 11:30 a.m. at Rose of Sharon Church. And then our last one is June 27th at 8:30 a.m. to 11:30 a.m. at Union Baptist Church. We're still in the process of trying to add 1 or 2 more churches on, but as that information comes, we will definitely make you aware of it. But as we begin to talk about what we're doing, I guess the questions really switch to Dr. Ford to really find out how do you go about beginning to register for it? What does it cost? Will insurance bill you? Can you help us out with some of the basic information on this testing? So let's start.
So first of all, we would like for people to hopefully view this in a positive light. I'm a family doctor. I'm a family physician, and one of the premises of most family doctors, and I take it very seriously, is prevention. And so we're trying to, like it has been stated, either prevent the spread of disease, or if someone is sick and may not know it, you mean sick and infected with the COVID-19 and not know it, that you would know it and then contain that infection by quarantining. And so keep that in mind. This is all what we're trying to do is prevention. And so first thing, just have the mindset of prevention. 2, on the flyer on my website at drtabby.org, and you can pre-register, and that would just streamline the process. I don't think it's on that flyer, but I think it's on the subsequent flyers that were presented. So it's www.drtabby.org. And you can click, there's a tab for COVID-19 testing. You can click on that. Otherwise, people can walk up and we will hand them a paper registration form to fill out, the basic demographics. Where do you live? If you're having any symptoms, it'll just be good for us to know. And then we do ask that you bring an ID with you so we can know who you are, verify who you are. And we are asking people, if you have it, to bring your insurance card with you. Your insurance card will be billed if you have it. If people come for testing and they do not have insurance, then they will still get tested. If the insurance doesn't, you have insurance, but it doesn't cover the testing, you will still get testing and you will not get billed. If they only cover part of it, then you will still not get billed. So the whole purpose is to provide a service to the community where we go out and meet the patients where they are. So testing has been available. I'm not doing anything new with testing. I do have the swabs that are for the nose and the pharynx. And the preference is to take it from the nasal pharynx and the nose. It takes about 10 to 15 seconds tops, and we'll have your results in about 48 hours.
All right. So I can pre-register, but it's not mandatory that I pre-register.
Correct.
Will I get through the line any faster if I pre-register?
You will get through the line so much more faster. It'll probably take about 5 minutes. If you were to be pre-registered, we would just kind of verify who you are, have you confirm your name, date of birth, have you go to a testing line. You take the test. It takes about, I don't know, it takes longer for us to unscrew the cap than to actually do the test. It'll take about 5 minutes if you're pre-registered.
All right. Why do I need my insurance card?
Why do you need your insurance card? Because
Yeah.
so I am a private physician, meaning that I do not receive funding from the state or federal government. And so there are costs that I am assuming, and billing your insurance will help offset some of those costs. It may not offset all of it. Like I said, this is a community service, but that is the reason. When you're dealing with, I don't know the city budgets that have you, but when you're dealing with municipalities or the community health centers, they're receiving funding and support from the state and the federal government, which I do not have access to.
Okay. So let me ask you this. What if I test positive for COVID-19?
So if you test positive for COVID-19, so everyone will get a call that your test is positive or negative. If you test positive, then one, you will be informed that. Two, you will be advised that you need to quarantine. And three, the person will be advised that they need to follow up if they have a primary care physician or private doctor. Then you need to follow up with your private doctor for additional care. If they don't, then we will work to try to direct them to receive care based on their location or availability, insurance constraints, what have you.
So a question was asked, do kids need to be tested?
So children should also be tested. And a lot of times, the children are the asymptomatic carriers. So they're carrying the virus in their nose, or the upper respiratory system. And the thought is, we don't know the exact percentage, but the thought is they're the ones that are carrying it. They may not have any symptoms, but they're passing it on to other people.
So it is important for our children to be tested as well. Thank you. Here's a question. Yes. When we get back to church for worship, should all of us get tested as we're coming back and forth?
So everyone should get tested. You should know your status. And this is separate. We had a similar slogan when we talked about other diseases, specifically HIV, know your status. But this is even more important to know your status, because the risk of spreading it, the ease of spreading it, and the risk of spreading it, and the opportunity to spread it just with casual contact is so great that everyone should know that their status and be checked.
Wow, thank you, thank you. Here's another question: how many times can I get tested?
Okay, so technically you can get tested as many times as you want, as many times that are available. The reality is, if you get tested and you test negative, then the likelihood is you are negative and you don't have any symptoms. And for that person, I would generally wait until you have symptoms, or sometime down the road, that person can go and have antibody test done. And so the antibody test is a blood test, and that would measure COVID-19 antibodies in your blood to see if you've ever been in contact with it. So it won't tell you if you're immune. It'll just tell you if your body was in contact with it and if you reacted to that contact.
All right. So Crystal Clark Taylor asks, how often should we be tested if we continue to get tested?
So that actually varies. And so for the average person, you really only need to be tested once. If you want to be tested and 4 to 6 months later, you can, as the seasons change, and now it's, you're getting towards the fall and winter. If you like to be tested again, that would be appropriate. If you're a medical worker or someone who works in the healthcare environment, and specifically a high risk environment, so we talked about nursing homes prior. I know daycare centers, what have you. Some staff members get tested once a month. I know. One of the nursing homes here in town, they test every 2 weeks. They test their staff members every 2 weeks. So we are given a lot of leeway as far as the amount of testing, or how the frequency of testing of our staff members in the medical world, and the daycare centers. But usually all of the workers are tested in those type of settings.
All right. So another question has come in: is there a saliva test also?
I am not aware of a saliva only test. So if there is one, I cannot speak to that. I can tell you that the SARS virus lives, which is the SARS-2 virus, COVID-19, which causes COVID-19, lives in the back of the nose and the back of the mouth. So the back of the nose we call the nasal pharynx, the back of the mouth the oral pharynx. And so the best way to test is in those far areas in the back of the nose and the throat. There are new testing. There are new testing kits coming out for kind of the anterior nasal testing. That is not the preferred test. The preferred test is to go back where we know that the virus lives and thrives.
All right. As you can see, the next question is there a such thing as a false positive?
Okay. So it kind of depends on the test. In general, so far, when I say test, I'm really referring to the swab test in the nose or the mouth, checking for the genetic material of the virus. Okay. And so, in general, when that is positive, it's positive. Um, it actually is a two-pronged test, not to get technical. And so they're looking for two different genetic materials, two different genes, or two different pieces of genetic material. Um, the best test or the truest positive will detect both of those pieces of genetic material. There are some people where you test, one test will be positive, one part of the test is positive, and the other part isn't, and it's presumed positive because if you have one part, you probably have the other. And then if you find neither, so if both of those parts of the test are negative, then it's negative. So the question is a little tricky. You can have people who have one test is positive, one is negative, and they may be clearing the virus and haven't cleared it all the way. And so they're in that in between phase. So technically the answer is yes, but I would err on the side if even one part of that test is positive, we consider them to be positive until we cannot track that genetic material anymore.
Now I know we are closely reaching 8 o'clock, but Dr. Tabitha, I know you mentioned about the antibodies test. Do you do that test as well? And will
Yes.
insurance cover it?
Okay. So most insurances cover it. And so sad to say, some insurances find a loophole and not cover it. So I would advise most people to contact their insurance carrier. When we say insurance, there are insurance companies. They're like 5 major companies, private companies, and then you have Medicaid for the underinsured and care for the elderly. Medicare, Medicaid will cover it, hands down. Those other 5 insurances, you have to make sure that your company has purchased a plan under that insurance name that will cover it.
All right, thank you. And as you can see, if you'd like more information on that, or you would like to get the antibody testing, you can see Dr. Tabitha Fort's information scrolling at the bottom of your screen for you to reach out to her at any point. It is, like I said, it is close to 8 o'clock, and we don't want to hold our audience too long, but I want to thank all of you for joining us for this discussion. Again, we just want to reiterate that we will be doing testing beginning June 18th at Faith Tabernacle from 7:30 a.m. to 11 a.m. And then we will have testing on June 20th from 8:30 a.m. to 11:30 a.m. at Rose of Sharon Church, and on June 27th from 8:30 a.m. to 11:30 a.m. at Union Baptist Church. Listen, we encourage everyone to get tested so that you can know your status. It's easy. I was just reading an article, and they were saying that most people who are passing on the COVID virus are those who are either asymptomatic or pre-symptomatic. And so we just want to make sure that we are responsible and we're not infecting those who we love. You can easily go to Dr. Tabitha's website, drtabby.org, and register, pre-register, and you can be in and out. You can register for any one of the sites through her website. Listen, I hope that you have enjoyed this. Ted, thank you. Dr. Tabitha, Guy Ford, thank you for joining us on today and for giving us such great information that we can use.
Thank you.
Thank you, Reverend, and thank you to all your listeners.
Thank you.
All right, guys. Have a great night. Thank you very much, guys.
All right, you too. Listen, I just want to tell everyone you have a blessed night, and we'll see you on tomorrow.
All right. Thank you,
Bye.
man. Goodbye. Good night.
Good night and be safe.